Hi, I'm Debbie McKeever, a developmental therapist with Achieva Early Intervention. In today's episode, we are going to see what behavior looks like in babies 0 to 6 months old. What are they doing to show us how behaviors are happening? Well, it might not be a behavior where they're acting out or hitting, but it might be a behavior where they're playing, they're reaching, they're holding toys in both hands. Maybe they're switching toys from one hand to the other hand. Those are all things that they're doing considered behaviors because that's what babies at this age do. They play. At this age, babies put a lot of things in their mouth. That's how they learn. That's the way they explore things. So you might give them a new pacifier and they might immediately spit it out. That's them trying to tell you, I don't like that. But you give them their favorite one that they always use and they're happy as can be, very content. So they are starting to show preferences at this age. A red flag might be our babies not reaching for toys, our babies not making any expressions at all. If our babies aren't playing and they're not attempting to reach for things and smile and coo and make noises, if our baby hears things that are very loud and they're not turning their head towards it, that might be a red flag. Because we want them to communicate that they hear something, that it startles them. Particularly if you're using your finger and you're going across from one side of their face to the other, they should be turning their head and looking both directions. And this is the same as they see people walk across the room. By 3 months, you want to make sure that they're noticing that that's happening, especially mom and dad. Once they're hearing their voices, we want them to be turning that way. At Achieva, we know that you know your baby best. You'll be the first one to notice if there's a change in their behavior. If you have any questions or concerns about your baby's development, contact the experts at Achieva Early Intervention.